Medicine in the modern period, 1900 to present day. At the start of the 20th century, photographs, film, electricity, the bicycle and the motor car had all been invented, but many people continued to live in cramped and unhygienic conditions, using oil lamps or gas lighting. Despite medical advances, many people would simply not be able to afford to see a doctor, and the average life expectancy in 1901 was only 47. Pasteur's germ theory had led to a range of vaccinations being developed, but there had been little progress in the search for a way to cure diseases, and most medicines were still based on mixtures of ingredients such as plants and spices. The 20th century was a story of huge improvements in the treatment of illness. Most people in the UK now have better living standards than in the 19th century and offer better diets as a result of our increased prosperity. We also tend to assume that even if we don't have a cure for an illness now, science will probably find one in the future, and we can successfully treat far more health problems such as heart conditions. The 20th century was also dominated by significant events that defined the modern era: Spanish flu pandemic, World War I and World War II, nuclear weapons, nuclear power and space exploration, technological advances, the Cold War and post-war conflicts, and more recently in the 21st century, the COVID-19 global pandemic. All of these events have had a profound impact on the development of medical understanding and treatment. Causes. In 1951, Rosalind Franklin created images of DNA using X-rays. James Watson and Francis Crick used these in 1953 to discover that DNA was shaped as a double helix. Now they knew DNA's structure, they could unpick it to find specifically what caused hereditary diseases. In 1990, the Human Genome Project was launched. For 10 years, 18 teams of scientists worked to map the human genome, and it was completed in 2003. A human has 3 billion DNA pairs. This has enabled doctors to study DNA for mistakes. Scientists can now identify a specific gene that causes breast cancer. In 1950, Richard Doll found smoking was the main cause for lung cancer. His scientific research was funded by the government. Scientists think that 89% of lung cancer cases are preventable. By 1985, smoking-related deaths cost the NHS £165 million. Over time, it became clear that the government needed to intervene. Later, other lifestyle choices were linked to disease, such as too much alcohol, which were linked to liver damage. Intravenous drug taking or unprecedented sex can lead to the spread of diseases like HIV. Tanning, either naturally or using sunbeds, has led to an increased number of skin cancer cases. Technology has advanced also. We now have ultrasounds, MRI scans, endoscopes, blood and heart pressure monitors or ECGs. All of these things are used for diagnosis. Physicians still use observation, but now we use laboratory tests extensively. These include blood tests. Treatments. As the problems associated with pain and infection had been solved in the industrial period, the only problem remaining was blood loss. In 1901, Karl Landsteiner found the blood groups A, B and O, followed by the discovery of blood group AB in 1902. This meant blood transfusions could happen with little risk. During World War I, doctors found ways to store blood. Louison in 1915 added sodium citrate to blood. This prevented clotting, while refrigerated blood. No longer operations could occur. The First World War saw a huge rise in the number of drastic facial injuries. Surgeon Harold Gillies developed a new method of facial reconstructive surgery in 1917. His work marked the dawn of plastic surgery as we know it today. Harvey Cushing was an American neurosurgeon, a pioneer of brain surgery during World War I. He used magnets to extract bullets from heads of wounded soldiers. Technology has also enabled operations to become less invasive and more precise, such as keyhole surgery and robotic surgery. Magic bullets were the first effective chemical cures. In 1909, Ehrlich found Sulfason 606 killed germs causing syphilis. In 1932, Dogmack found Prontosil killed blood poisoning. Penicillin was the first antibiotic. Fleming rediscovered penicillin by chance and wrote about it in 1928. Florey and Chain purified penicillin, tested it on humans, and mass-produced it with the help of American funding. 2.3 million doses were used on D-Day. Radiotherapy and chemotherapy have also become widely used as treatments for cancers. American doctors Goodman and Gilman, whilst trying to find an antidote for mustard gas, found another use for the compound. In 1942, the first patient received chemotherapy. Back in Britain in 1948, Professor Alexander Hadar experimented with the molecules. He made it less toxic to the patient, but more potent in killing cancer cells. Preventions. From 1900, the government assumed responsibility for improving the public's health. The Liberal government paid for free school meals in 1906 and introduced the old age pension in 1908 to help ensure people ate enough and kept warm and were less susceptible to disease. Free milk was introduced for primary school children in 1934. This helped develop their bones and provided them with vital nutrients. The National Vaccination Campaign 1942 against diphtheria was aimed at children. This was followed by another vaccination campaigns for polio, MMR and HPV. The government has also passed laws to provide a healthy environment for the population, such as the Clean Air Acts of 1956 and 1968, triggered by bad episodes of smog in London in 1952. The government also tried to prevent lung cancer by banning TV adverts for cigarettes in 1965, making health warnings on packets compulsory in 1971, making it illegal to smoke in a public space, and raising the age you can buy cigarettes to 18 in 2007. The government also run lifestyle campaigns via education and advertisements. Change for Life, 5 a Day, Stoptober and Dry January. In 2018, to tackle childhood obesity, the UK government launched the sugar tax on soft drink companies. It is expected to raise £240 million each year. This money will go towards helping schools upgrade their sports facilities and give children access to top quality PE equipment. The levy will also give a funding boost for healthy school breakfast clubs. Care. Who cares for the sick has seen considerable change during the 20th and 21st centuries. Housewives still dominated before 1948. But we now have professional, highly trained pharmacists, and nursing is now a degree-level profession. You may need to see a professional physiotherapist who have their origins in the Greek and Roman times with Hippocrates and Galen. Physicians are now commonly known as GPs and after 1948 practice from NHS GP surgeries. Surgeons now specialise, such as brain or heart surgeons. Patients were treated in private hospitals, voluntary charity and local government hospitals before 1948. In 1911, the Liberal government's National Insurance Act provided help for workers who fell ill. This, however, only included workers In 1947, 8 million people had never seen a doctor because they couldn't afford to do so. In 1948, following the Beveridge Report and via support of Labour Minister of Health at the time, Bevan, the government began the National Health Service, or the NHS. This provided free healthcare for all at the point of need and meant treatments were accessed by far more people. Ambulances now respond to 999 calls and transport patients to specialist hospitals.